afternoon, folks. My name is EMT Studdart, and today we'll be doing a demonstration of using the OPA and the NPA for a trauma patient, right? The first thing we want to do is open the patient area. If there's a suspected spinal injury possibility, we don't want to do a head to chin lift in this position. We want to do a jaw thrust maneuver by holding the patient's mandible and pushing forward, doing the jaw thrust, opening the airway that way, right? The NPA is contraindicated in most cases for severe head trauma, where you feel cervical spinal fluid and other types of damages to the patient's airway, right? We would utilize an OPA if the patient has an intact gag reflex and unresponsive. We would do that by measuring, right, from the corner of the patient's mouth, to the angle of the mandible. And if it is the right size, we will insert it by turning it upwards, away from the patient's tongue, and then flipping it 180 degrees when we're going down into the patient's mouth, right? And then we would then, while it's inserted, use the BVM to deliver rescue breaths. Now, if there is no contraindication to use the OPA, the NPA, then you would insert this by lubricating it, right? And from the right near, we would insert it with the bezel pointing upward and into the patient's nostril and down, right? If it's the left nostril, we would insert it the opposite direction, halfway, and then the other half we would turn it and follow through, right? And then we would use our BVM once it's inserted to deliver the rescue breaths. And that is for a trauma patient. Thank you.